In this video, I'd like to address one of the things that comes up from time to time in my practice, and that is autism spectrum disorders. Now, the fact that we talk about autism spectrum disorders shows that we're really talking about a wide variation in autistic behavior along a continuum, and a child's behavior can fall anywhere along that continuum from quite mild to being quite severe. Now, you might also find the terms autistic spectrum disorder interchangeable with pervasive developmental disorders, which really gives you an indication of the fact that these kinds of difficulties really might affect every single aspect of a child's daily life. Now, in general, there are some things that we look for before we diagnose autism spectrum disorders, and it's usually something that happens within a team. It's very rare for a pediatrician or a psychologist to make the diagnosis on their own. We'll usually all work with the child and then discuss the symptoms together and then decide whether it fits the necessary criteria. Now, some of the things we look for instance, is difficulties in using language to communicate with others. And quite often, a developmental delay in the sense of a delay in language acquisition is one of the first signs to alert us that perhaps we're looking for a diagnosis on the autism spectrum disorder. Children often also have difficulties developing relationships with others. So, for instance, there might seem to be a slight lack of awareness of others or a reluctance to make eye contact and to look at others. Now, on this point, for a very long time, before we really understood autism disorder, we used to sometimes make the mistake of thinking that children didn't want social interaction, that they didn't want to actually interact with others, but they need cuddles and loves and social interaction just as much as any other child. It's just the way in which they do it, and quite often they find it quite overwhelming when they don't expect it. So with a child on the autism spectrum disorder, you might want to just wait. It might need to come from the child sometimes. Wait until they approach you for a hug or a cuddle instead of constantly trying to get to them and to give them that love. It's also, sometimes we note that children on the autism spectrum disorder don't really make use of pretend play or their imagination. So they usually love toys and love to play with them, but we find that they won't necessarily play with them in an imaginative way. So quite often they get fixated on a certain aspect of a toy. For instance, a child with autism spectrum disorder might get fascinated by a car wheel turning and might play with that wheel turning over and over again, but won't necessarily take the car and play that he's driving along a road. Now, classic autism really presents when a child has language difficulties, when they don't seem to want to socialize with others, and quite often along with classic autism we find that there might be some learning difficulties or cognitive delay. Again, it's not always the case. Because children fall anywhere on that continuum, you might have a child with severe language delay but absolutely normal or above average cognitive abilities. Now, classic autism is considered to be at the slightly more severe end of the autistic spectrum, and on the higher functioning or the milder end of the spectrum, we get something that we call Asperger syndrome. Now, in Asperger syndrome, we often find that language develops rather normally. There's not that big delay in speech development, but the speech might show some unusual characteristics. So we might find that the pitch of the voice is different. A lot of children who are on the autistic spectrum disorder will raise the last letter or raise their voice on the last word rather of a sentence. So it always sounds like they're asking you a question, and that's one of the things that we look out for. We also might see atypical behaviors, atypical movements. Quite often they might be a little bit rigid in their movement. A lot of children with autism prefer to walk on their toes rather than flat on the feet. And when we look specifically at Asperger's, we find that some children might have excellent vocabularies, but there's something in the social aspects of the speech that aren't really there. So they're talking quite a lot, but it's not really the social words and connecting with others and using personal pronouns in the way that we would expect it to. They also, we find sometimes there might be a fascination with one topic. So, for instance, a child might be absolutely fascinated with all forms of transport, but then not really be interested in anything else around, that they're presented with at school, perhaps no interest in animals or some of the other topics. Routine is massively important for children who are on the autism spectrum disorder. So we find that they have severe difficulty moving from one task to another. They usually need a lot of prompting, a lot of preparation. And what seems to work really well is to have a visual reminder of the day's schedule and what to expect. So if a child knows that first they're going to sit down to do work for half an hour, then they're going to wash their hands, then they're going to have lunch, that often just helps that transition a little bit more. A lot of repetitive movements and a great need for repetitive movement. So if you find yourself in a position where you deal with a child on the autism spectrum disorder quite often, be sure to plan for that, so that when they do need to get up and if they do need to do the same repetitive movement, try and incorporate that into your plan for the day or your lesson planning without trying to limit them. And as with most difficulties, early intervention is especially important when it comes to any disorders on the autism spectrum. So there are only certain ages at which we can diagnose an autism spectrum disorder, but we want to make sure that we are alerted to that as early on as possible and that we get a correct diagnosis so that we can get the child the real help that he might need so he can thrive going forward to school and socially and at home and wherever he goes. Autism spectrum disorder can be a difficult diagnosis to get, and it tends to be one that causes parents a fair amount of distress. But take heart in the fact that positive outcomes are possible and that children on the spectrum can grow up to live happy, successful lives.